Piperacillin-Tazobactam Vial is a medication used to treat a wide range of bacterial infections. It is a type of penicillin antibiotic that works by preventing the growth of bacteria. This medication is usually given through an injection into a vein by a healthcare professional. The dosage and frequency of administration will be determined by your healthcare provider based on your medical condition and response to treatment. It is important to follow the instructions provided by your healthcare provider and take this medication at the same time each day for the best results. When using Piperacillin-Tazobactam Vial, it is important to follow your doctor's instructions. It is typically injected into a vein every 6 hours, and should be injected slowly over at least 30 minutes. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dosage is based on their age and weight. If you are administering this medication at home, make sure to learn the proper preparation and usage instructions from your healthcare professional. Before using it, check the product for any particles or discoloration. If you see either of these, do not use the liquid. It's important to store and discard medical supplies safely. If you are using the frozen pre-mixed solution, allow the container to thaw at room temperature or in the refrigerator. If you thaw it in the refrigerator, let it sit at room temperature for at least 1 hour before using. Do not thaw it using warm/hot water or a microwave. After thawing, shake the container well and squeeze it to check for leaks. If it leaks, discard it. Do not refreeze the solution after thawing. To get the best results, use this antibiotic at evenly spaced times. Try to use it at the same time every day to help you remember. Make sure to continue using this medication for the full time prescribed, even if your symptoms improve after a few days. Stopping the medication too early may cause the infection to come back. If your condition lasts or gets worse, be sure to inform your doctor. Some common side effects of Piperacillin-Tazobactam Vial may include nausea, constipation, diarrhea, headache, or trouble sleeping. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. However, you should inform your doctor immediately if you experience any serious side effects, such as easy bruising or bleeding. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal or stomach pain, cramping, or blood/mucus in your stool, contact your doctor right away. Do not use anti-diarrhea or opioid products as they may worsen symptoms. Long-term or repeated use of this medication may lead to oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. Seek immediate medical help if you experience very serious side effects, including seizures, signs of kidney problems, or symptoms of a serious allergic reaction such as fever, rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA. Similarly, in Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada. Before using Piperacillin/Tazobactam, make sure to inform your doctor or pharmacist about any allergies you may have, especially to antibiotics like penicillins or cephalosporins. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss any concerns with your pharmacist. It's also important to let your doctor or pharmacist know about your medical history, especially if you have cystic fibrosis, kidney disease, or a seizure disorder. Additionally, if you are on a salt-restricted diet or have conditions such as heart failure or high blood pressure that could be worsened by an increase in salt intake, consult your healthcare professional before using this medication as it contains sodium. Furthermore, Piperacillin/Tazobactam may affect the effectiveness of live bacterial vaccines such as the typhoid vaccine, so be sure to inform your healthcare professional before receiving any immunizations or vaccinations while using this medication. If you are planning to have surgery, it's important to disclose all the products you are using, including prescription drugs, non-prescription drugs, and herbal products, to your doctor or dentist. For older adults, it's important to note that they may be more sensitive to the extra sodium in this medication. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication as it can pass into breast milk in small amounts. When taking Piperacillin-Tazobactam Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Piperacillin-Tazobactam Vial is methotrexate. Additionally, this medication may interfere with certain lab tests, potentially leading to false test results. It's important to inform lab personnel and all your doctors that you are using this drug. If you suspect someone has overdosed on Piperacillin-Tazobactam Vial and they are experiencing serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, reach out to a poison control center for assistance. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of overdose may include seizures. It's important to seek help right away in case of an overdose. It's important to have lab and medical tests done while using Piperacillin-Tazobactam Vial, such as complete blood count, sodium/potassium blood levels, and kidney/liver function tests. Make sure to keep all medical and lab appointments as recommended by your healthcare provider. This will help ensure the medication is working effectively and monitor any potential side effects. When using Piperacillin-Tazobactam Vial, it is crucial to take each dose as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. It is important not to take a double dose to make up for a missed one. This medication is typically administered intravenously by a healthcare professional, and the dosage is based on your medical condition and response to treatment. Be sure to follow your doctor's instructions carefully. It is also important to take this medication at the same time each day to maintain a consistent level in your body. Be sure to follow the product instructions or ask your pharmacist about how to store this medication. Keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or down the drain unless instructed to do so. Be sure to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.